Hi everyone, I am Dr. Atmaranjan Dash. I am a brain surgeon and a spine surgeon. Basically, I'm a neurosurgeon and endoscopic spine surgeon. Let's discuss about advanced neurosurgical and spine surgical procedures. The first topic I'm going to discuss about is cervical disc replacement or artificial disc replacement. We know cervical spondylitis is a very common disease nowadays, even with youngsters. This happens with neck flexion because constantly, if you start working on the laptop or mobile phones while looking down, your neck and the head will cause sprain on the neck, leading to cervical spondylitis. This is the first phase of cervical spondylitis. You will experience neck pain followed by a hand pain, pain radiation to the hand. So this is known as stage 1 of the cervical spondylitis. Some of the cases may progress to stage 3 of symptoms, which is known as myelopathic phase. Myelopathy, what is myelopathy? When the nerve roots are compressed. Nerve root means the nerve supplying your hand. If it is compressed, then you will have symptoms of pain. But when the main spinal cord or spinal trunk is compressed, it will lead to myelopathy. Myelopathy means the patient will start experiencing symptoms such as tingling and numbness, and also inability to button and unbutton and use your small fingers. Sometimes some people chant with spiritual chanting they cannot do that. Some people the handwriting will change. Some people won't be able to hold the spoon or able to eat with the hand. Some people cannot count currency notes. So these are the symptoms of third stage of cervical spondylitis. Some of the patient will also experience imbalance while walking, which is also because of the balancing nerves start from the neck. If it is compressed, it will lead to imbalance while walking. Some people will start walking like a robot. They will walk like this. There's a balanced change of gait. Which may happen with cervical spondylitis. Some people experience as if somebody has applied Amritanjan on the body. They will get this cold and hot sensation in the body. Some of the patient also experience frequency of urination. You'll feel like you have to go to the washroom to pee, or you're going to pee on your pants. So these are very common symptoms of stage 3 and stage 4 cervical spondylitis or myelopathic phase of cervical spondylitis. In myelopathic phase and in the stage 2 also, when the pain is very very severe and unbearable, we sometimes offer cervical surgery, cervical spine decompression surgeries. Now, previously there are one surgery which is known as SCDF surgery, which is a fusion surgery where we remove the disc and replace it with a material where we fuse the two vertebral bodies. But sometimes patient may experience stiffness and numbness in the neck, and because it's a fusion surgery leading to reduced range of motion. So now we have a advanced cervical disc replacement or artificial disc replacement or motion preservation surgery. In the motion preservation surgery, because the motion is a very important factor in, especially in young patients who are going to engage in sports activity, travel and all, and because they are the active population group, so artificial disc replacement is mostly recommended for young patient. Also the elderly patient can take the advantage of artificial disc replacement. Artificial disc replacement or cervical disc replacement is a much easier surgical option than a ACDF surgery, and the surgery is done around 20 to 30 minutes of duration. You can work on the same day and you can be discharged on the next day of surgery. The range of motion, this is known as the range of motion of the neck. This range of motion is preserved, well preserved, because you replace the degenerated disc with an artificial disc. This is the same disc material of the original disc. They function in the same way like we do hip replacement or knee replacement surgery. So if you are having cervical related issues and have gone to stage 3 of cervical spondylitis, the pain is unbearable and you are experiencing symptoms as I mentioned previously, you can choose a cervical decompression surgery. If you are choosing, then artificial disc replacement is a very good surgical option. It's an easy surgery, much reduced pain. So naturally, whenever patient come, they the first criteria is pain. So this is a painless surgery, and you can ambulate on the next day, and your motion of the neck is well preserved after the surgery. So if you're choosing or thinking of advanced surgical option, then artificial disc replacement is the point for you. Thank you so much.